Welcome to December 11th, 2015 Friday Focus. Now, recently we talked about you cannot give good customer service without a sale, because without a sale, customer service cannot even be delivered. So we might think, well, we're making a nice lobby and we're welcoming people being nice on the phone, but unless you give them a service, you really haven't given customer service. And now I'm going to talk about what makes a happy versus an unhappy patient. A lot of times I'll hear, Dr. Moak, this patient had this procedure done and she's really not happy. This is an unhappy patient. And what makes people unhappy? Well, there's a lot of things, and it could be something went wrong. Obviously we've got to deal with that. But the most frequent reason for an unhappy patient, happiness equals not enough. Now I want you to think about this. When you're encountering a patient that's not happy, they don't say, you gave me too much filler. You made my stomach too small and flat. You got rid of too many of my veins. I want to have some of them still. My wrinkles are too gone and too soft. I have too few brown spots. Most commonly, we didn't really give them enough services. When I'm hearing the patient is unhappy, it's actually a happy patient that you didn't interpret their words enough. So they came in and they said, well, I still have wrinkles, okay? And you're like, well, this patient's not happy with their Botox or their filler. In reality, they're saying, well, I'm happy with them, but I want more. I want more than you delivered. And sometimes it's our bias to give them enough because we're worried about what it's going to cost or how they're going to proceed the sale. And I would conjecture that if you were to talk to people about the maximum results in whatever they're looking for, like if they want the maximum results for the face without surgery, we're not really talking about the maximum results with surgery. We'll be talking about the maximum results with, say, Fraxel and Ulthera or Thermage, skin tightening procedures, maybe some fat reduction in their neck, laser resurfacing, Botox, filler. And let them decide they don't want all that. Because if you do it the other way around and they come in and they have significant concerns, I'm talking about my brown spots and my wrinkles and my fine lines and my acne scarring, my wrinkles around my eyes and loss of volume in my cheeks, you say, well, let's do some Fraxel. They're going to be unhappy because Fraxel alone is obviously not going to address those things. It'll address one thing. Now with the new Magic Lift package, we have a little bit more leeway because we can combine things together, and I really want to focus on that. When the patient comes in that's never been here before, they're a brand new patient to our practice, and they've been going somewhere else getting $80 or $200 with the Botox. That's a tough patient because they were accustomed to being under-delivered. And I'll tell you that I don't even want those patients for myself. I don't want to see them because I know what's going to happen. I'm going to talk to them about getting more. They're not going to want it. And when I spend $200, and I'll choose not to inject them because if I do, they'll tell me, didn't work enough, I need a touch-up. And there's a lot of work in that. There's not very much revenue for our practice. Versus the new patient that hasn't anything done before, or a conquest patient that was in another part of our office and comes to see us. We talk about maximum results and then deliver them. Now you have a patient for life because you gave maximum results. And sometimes it's a matter of our own prejudice says, well, they don't want to spend that much money. They're not going to want that big sale, so I'll talk about something simple. So let's go this department by department. Let's say the patient comes in for fat reduction, non-surgical fat reduction, and we sell them one cycle on their stomach and lower belly, and we know what happens with that. They're not happy. In fact, we went through a whole year of that. We were doing a lot of cool sculpting. It was real popular, but we realized we got to do 2 treatments in multiple areas, a minimum, maybe even 3 treatments, and that made our happiness go up. In fact, before we were doing the 2 to 3 treatments, I was having to see every patient in their follow-up and explain to them how the pictures show some significant indifference, even though it's slight. Now it's not an issue. They're happy. Let's say the patient comes in for their veins, and they've got some varicose veins and some spider veins. And we make the easy sale, which is treating their varicose veins that their insurance might cover, and we don't talk to them about the need for repeated spider vein treatment and even maintenance. Now we have a patient that's unhappy because they say, my legs look the same. Yeah, they feel better, but they look the same. Well, they do because we didn't set the expectations and give them the maximum sale. The patient comes in that's middle-aged woman that's got a deflated face, some wrinkles, and we talk to them about 1 or 2 things, a couple syringes of filler, maybe a little Botox. In reality, she needs a lot of filler, a lot of Botox, maybe some laser resurfacing, maybe some skin tightening. We put those things together and make a bigger sale, you'll definitely have a happier patient, okay? I learned this years ago when the companies were trying to get us to sell 1 syringe of filler for the nasolabial folds. And I was talking to a friend of mine who came out to visit, and I talked to him about the concept of, I don't want to do that anymore because I'm seeing everyone's patients back and I'm showing them their pictures. I'm trying to make them expert in photography. They can see it. we decided just to go for like maximum treatment. Let's do 3 syringes, not even sell one, except for by exception. Then all of a sudden, propelled our practice forward. Then we realized, what about 6? Well, I mean, they're going to be happier with 6 syringes than with 3. Now we're doing 12, 16, 18. Patients are clearly happier. And it's our own bias thinking that people won't go for that. They won't want it. They actually do. They want to get maximum results. And if you sell them a $500 Botox package or $500,000 Botox filler package, yeah, they'll see some improvement. Maybe they'll stay with us. But if you do a maximal package, $4,000 or $5,000, they're going to get maximum results. They'll refer you more patients, and they'll more likely retain with our practice. And this is what I want the take-home message to be, okay? If you're in dermatology, you don't address all their concerns. If you're in the hormone department, you don't address their concerns. In the vein department, you don't address their concerns. Surgery department, you don't address their concerns. The cosmetic department, you don't address all their concerns. You're going to have an unhappy patient. Whereas if you spell out to them what is going to give them the maximum benefit, and let's say they choose not to do it because of finance or whatever, in some cases you tell them, well, why don't you just wait till you can afford it, rather than do a $200 Botox patient. And other times we can kind of document it, write it down when they come back in and say, well, when we talked about doing more, let's see if we can roll that into the whole thing that we talked about. And, a lot of times I tell patients I'll guarantee the results, because who's going to say it didn't work when you use 12 syringes of filler? It's like impossible. So that's today's Friday Focus. I want to switch your brain around from the unhappy patient is actually a happy patient that we didn't give enough to. There's certain exceptions of that, obviously. They have an infection or something like that. But in general, the unhappy patient is the one that we did not over-deliver. Thank you very much.